Today at Time Magazine, we're looking at Crohn's disease, and we have three interesting articles. One that is about a deep look into Crohn's, another with personal testimonies, and one last one of shocking live photos of digestive tracts that are afflicted by Crohn's disease. Let's move on. So, Crohn's disease main symptoms are inflammation, malnutrition, weight loss, and bleeding. The main organs that are affected are the lower intestine, colon, but it can afflict pretty much anywhere in the gastrointestinal tract. Treatment includes anti-inflammatory medicine, special diets, therapy, and in extreme cases, surgery. The main cause is genetics, but it has been found that in colder cities and in bigger cities, there are more people with Crohn's. And now on to the digestive system. It starts with the mouth where food enters and it's chewed by the teeth and broken down by saliva. And then it goes through the esophagus, which is a muscle that is connected through the stomach, and it is pushed down through peristalsis. And here it is pushed into the stomach where the food is mixed with gastric juices, which are very acidic, and this breaks the food down further. And it is broken down using bile, which is produced in the liver. And the gallbladder is where this bile is stored. This bile is what goes into the stomach to break down the food further. And now after the stomach, it goes down into the large intestine where water is reabsorbed from the food and feces is stored until it's ready to be passed. And then it is moved on into the small intestine where it is mixed with digestive enzymes. And last but not least, it is moved to the bladder. Now for the feature article on Crohn's. So Crohn's is a type of inflammatory bowel disease, and it causes your GI tract to become inflamed, which can cause pain, bleeding, constipation, severe diarrhea. And other complications are weight loss, fatigue, and malnutrition. It targets the inner lining, which thins it out, and it is not active all the time. There are active periods and remissive periods, so the body is not being attacked and inflamed constantly. Treatments include medication that suppress the inflammation, so it forces it into those remission periods. Special types of therapy, diets that are mainly bland food and soft food as to not inflame the GI tract, and surgery to remove diseased sections. Crohn's is generally genetic, but it can be more common in big, cold cities. Any organ can be affected from your mouth to your anus, but it generally affects the colon and small intestine. And the function of the colon is to reabsorb fluids and process waste. And the small intestine does most of the digestive process since it absorbs most of the nutrients and produces digestive juices. So when it's functioning properly, it works with the cardiovascular system to send nutrients into the bloodstream and then also sends the remaining food into the bladder. And then the colon also works with the excretory system, specifically the anus, since it is the last stop before the anus where the food is eliminated. In patients with Crohn, the small intestine will be inflamed, constricted, have ulcerations, and sometimes bleeding. Because of this, patients will experience pain, anemia, weight loss, and bloating, and the small intestine will have trouble absorbing nutrients, so the patients will not have everything they need in their bloodstream to function properly, which will also affect metabolism, which then also affects the endocrine system. In the colon, inflammation will alter the internal lining, so some areas are thicker and some are thinner, so it will be harder for food to pass through easily. If the inflammation is very bad, it can spread past the colon and into the anus, which creates a fistula. This would make it even harder to eliminate waste. Medicine can reduce inflammation, which is the main source of complications with Crohn's, but in worse situations, surgery will remove the disease section altogether. Most patients have a very specific diet that excludes spicy food so that the inflammation is not aggravated. These treatments all work towards the same effect, reducing inflammation. Lastly, we have some sources that show what Crohn's disease is and inflammatory bowel disease, which is very similar to Crohn's. And here is a picture of what a healthy bowel looks like versus with Crohn's versus with ulcerative colitis, which is what can happen when Crohn's gets really bad. Thank you for watching.